So without further ado, it's my pleasure to hand you over to Louise Smith from DHCW, who's going to talk more about the NDR and what it means for social care in Wales. Louise, it's over to you.
Hiya, thanks Suzanne. I was going to say good morning then, but we've just switched to the afternoon shift, so good afternoon everybody. My name's Louise Smith and I'm going to talk to you a little bit today about the National Data Resource Programme. As Susanna said, that is run from within Digital Health and Care Wales. So I am one of the project managers within the NDR programme. There are, I think, 4 or 5 of us now as part of a kind of programme management office that's 10 or 12 strong, I think. But my background has always been kind of working within data related projects and fields. So prior to my current role, I was based in Swansea University, delivering European funded research and innovation projects. And I've also worked in, the private sector and web development agencies. So, I love data. I love the insights that you can kind of glean from different data sources. So I think I've maybe ended up in the right job. So I'm going to talk a little bit around the kind of context of digital health in Wales, more than about what is an NDR, what does it consist of, and then a little bit about the area that I'm most involved in, which is the kind of advanced analytics side of things, and some of the projects and initiatives that we are delivering to support in that space. So some of the background really behind the NDR programme. Many of you will probably be familiar with Welsh Government Healthier Wales strategy, which along with the Welsh Government Digital and Data Strategy for Health and Social Care in Wales all talk about the need for a single digital record to solve some of the problems that we face with connected health and care provision in Wales. So this is the sort of policy landscape really, and the problem that the National Data Resource is intended to start to resolve. So there's, a number of kind of platforms and services within the NDR, but as well as a platform, these strategies all talk about the collaboration and joint working that's needed to sort of create that digital ready workforce and with the skills and the confidence to use the data that we've got really effectively. And against that sort of policy landscape, the NDR has also got a data strategy to set out how we can make digital a force for good in health and care rather than being a barrier or a complex thing that kind of stands in the way of excellent care provision at the moment. And this is where the National Data Resource comes in, and you can see some of the objectives from the data strategy there. The NDR is intended to become the sort of singular comprehensive health and care data repository in Wales. And you can see some of the statements there from different users that were interviewed as part of this exercise to develop a data strategy about some of the problems that are faced that the NDR is intended to resolve. And again, just sort of calling out really, as well as the sort of infrastructure side of things about having the data in one place, having a suitably high quality of data according to data standards, and being able to access that data in a timely way really to support decision making on health and care. There are also all of the other aspects around data literacy and privacy that are incredibly important when we're talking about people's data and information. Which leads me on to what is the NDR, and it is a programme. It's a Welsh Government funded programme that initiated back in 2019, and it's a 10-year programme that's intended to achieve all of those wonderful strategic objectives that I've flagged already. But what is it? So there are a number of products and services that sit underneath that kind of NDR programme umbrella. that are outlined here, and this isn't exhaustive, it doesn't cover everything that we're doing, but generally speaking the NDR consists of the CDR, the Care Data Repository. So this is all about kind of live real-time operational data that is to do with direct care purposes, really. So this is the kind of real engine room, if you like, of data access, data provision, and that is accessed by a number of APIs, so application programming interfaces that can read from and write to the Care Data Repository. So that's kind of the core data store, if you like, of operational health and care data, primarily health. Then we've got NDAP, so the National Data and Analytics Platform. This is where the clever data scientists and analysts can get hands-on to the data, be it in aggregate form or still as PII, for the dashboards, insights, understanding what's going on, service design and development and improvement, and that's where we can link in with non-operational data sources to sort of perform those analytics about how to do things better, how do we become more efficient, how do we improve the services that we provide. We've then got a secure data environment, which performs another function again. So this is all around, whereas NDAP would be accessible by health and social care staff with appropriate roles and permissions to access data within their view and their slice of the National Data and Analytics Platform. The SDE is all around research, innovation, service improvement projects that might involve external partners. So we might have an academic partner, an industry partner, a third sector partner, or all of the above, working together on a project to answer a really specific use case. And so this is designed for kind of one-off projects primarily, but may be a use case for kind of persistent access. Might be with a charity, for example, or there might be a specific patient experience survey that's being conducted. So those data sets don't sit within a specific organisational slice, and they're not kind of operational in terms of feeding into applications that are used in clinical settings, but it might be a project that is run to develop something that then subsequently might get operationalised back into NDAP or the CDR potentially. And we've then got GitHub, Gig Cymru, which is another service that has been launched as part of the NDR programme, which is about kind of code management, version control and sharing of code. So if an analyst in I don't know, one health board in Hywel has developed code to generate a dashboard on patient-reported outcome measures of hip operations, then that code has been written once and can be made available to colleagues across Wales working in different organisations who may be able to take that code as a starting point and develop their own branch of that code to do something similar in a different context. So that's all about not rewriting the wheel every time a challenge or a problem is presented to an analyst. They don't have to start from scratch. If they can access some work that has been done elsewhere, then they can build on that. So that's a kind of one-page snapshot really of kind of 4 of the main services that are provided underneath that NDR umbrella, and they're all at different stages of maturity, but they are all available as live products as part of the NDR. So moving on to the advanced analytics part of things. So as I said, there's a number of kind of project managers, a number of projects and services being run within the NDR. I tend to work more closely on the advanced analytics side of things. So I'm just going to spend another 5 to 10 minutes or so sharing some information about what we're doing in this space. So I've already spoken a little bit about GitHub, Gig Cymru and the secure data environment. These are some of the tools and products and services that are available to our colleagues in health and care in Wales, again at different stages. But GitHub, for example, is something that we want to work with colleagues in local authorities to implement. So if anybody is particularly interested in getting involved and getting access to that, please give me a shout and we can see what we can do to try and enable that for you. We have got some licenses available that are funded by the NDR programme up to, I think, the end of this financial year, which would be March 2025. But let me know if you are interested in trying that out, because we it's a health and social care programme, so we need to obviously make sure that we involve colleagues from across Wales. We also run a number of projects that are more focused on kind of encouraging innovation. So some of you may have been involved in some of our big data events and our big data fund. So again, these events and the fund work that we delivered this year were about encouraging people to explore opportunities to better use big data. So, there are vast quantities of data out there. And so we run events to kind of showcase different examples of initiatives that really represent that kind of use of big data and innovation linked with big data. On the fund side of things, we had some money available last year. I'm not convinced we will get the budget to do it in the future, but we ran a sort of small funding scheme for projects. I think we had £150,000 and I think we had over £1 million worth of bids for that funding. And we awarded, I think, 5 projects under that fund. Again, different organisations, different projects, but they were all around better use of big data. And those the outcomes of those pieces of work then were also presented at one of our big data events. But the big data events run quarterly in partnership with the Life Sciences Hub Wales. I think the next one is due in January. So again, sign up to the NDR newsletter and you can find out more about those. But the next one is due in January. And I think the theme of the next one is around big data, bigger picture. So I think we've got some interested speakers coming along to that to again share some information about how they've used data and how they've overcome some of the hurdles in accessing and using big data in fields other than our own. The partnerships work referred to there is intending to find ways and develop a framework to guide colleagues who want to work with external organisations. So, I don't know if any of you have come across an opportunity maybe to work, as I say, with an academic partner or an industry or even a small business or a charity, and then you try and overcome the hurdles of commercial agreements or IP conversations or anything along those lines, and it just becomes so tricky to navigate that it's very easy to give up. And those are opportunities then of maybe developing something incredible that we've missed out on the chance to explore. So we're trying to build a sort of framework and checklist and templates to support people to start to navigate some of those challenges when we try and work with colleagues outside of health and care on projects. And then the capability side of things, which I could probably talk about for far too long, so I will try and summarise, but this is all around, you can't just develop a new system, you can't just develop a CDR or an NDAP or an SDE and just launch it and expect people to be able to use it. You know, it would be lovely if these things were as intuitive to not require training, but you know, we need to develop the skills and the competencies to enable people to utilise, well, A, the services that we've already got and the data that we've already got, and B, to utilise the kind of new systems and data that will flow through once the NDR is implemented and live and populated with data from across the health and care ecosystem. So we've got a number of learning programmes available that are intended to address the kind of helping people to learn how to utilise all of the services and the platforms, etc., that are that we are developing. So I've already spent quite a bit of time sort of talking about some of these schemes. So, you know, this is just a little bit more information about the areas in which our advanced analytics team is helping to build innovation across health and care in Wales. Some of these stats can probably be updated actually, because I think we've now held 6 big data events. So we tend to have around about between 100 and 130 attendees at each of those events, and again, they're accessible to colleagues from across health and care. So, you know, welcome any and all of you to come and join us at those. They are kind of really interesting snapshot presentations, so 10 to 15 minutes per speaker, just giving you some information about work that they're doing. So we've had colleagues from NHS England. I think we had Ming Tang at the last session. We've had colleagues from NHS Scotland. BT have come to speak to us previously. So yeah, they're all about bringing together the sort of clever people who know about data and know how to bring different data sources together to generate answers to questions, alongside, you know, potentially more senior colleagues who are kept awake at night by different operational or service challenges, just to understand, as they say, the art of the possible, and try and generate some ideas about how to solve different problems in different contexts and environments. So those big data events are sort of fairly regular, pretty well received, and yeah, we enjoy pulling them together, even though it can be a challenge at times. Then a little bit more here about the learning programmes. We have run an analytics learning programme across 4 cohorts now. The 5th cohort will start next year. We have published a request for expressions of interest, which I'm not sure if it will have been circulated to all of you, but it's definitely been circulated, or the intention has been to circulate it to far and wide to colleagues working within the social care space and within local authorities. So the closing date for expressions of interest to join the next analytics learning programme is the 6th of December. Again, please get in touch. Happy to signpost people to that information and where to apply. So the analytics learning programme is I'm going to say a sort of 6 to 8 month learning programme, which consists of taught modules, skills workshops really, and a practical hands-on team project. Depending on which learning pathway you follow, you could have, I think, only 3 taught modules if you just want to look at the kind of Google skills side of things, and you're already really well skilled in the analytics space. You know, you're a SQL expert and a Python whiz and a Power BI superstar. You know, I think that there is a really kind of stripped down Google only learning pathway for those who just want to learn Google, which is the technology on which the NDR platforms are built. Alternatively, there's like a core pathway, which I think now consists of, I think we're up to 11 modules, which are taught over one afternoon per week. So each module tends to be 4 or 4.5 hours, depending on how we split them. We tend to run them on a Wednesday. I'm not certain that that's what we're going to do next time around, but that has historically been when we've run those modules. So they would run from March through to probably end of July. And then we then have again, around about a 3-month project where teams are put together to build a proof of concept solution to a real problem that will have been submitted by a colleague that they want a team to address. So again, happy to provide more information, happy to provide a link for people who want to go on the course and submit expressions of interest. And equally, if any of you have got any burning challenges that you would love a team of analysts to take a look at for you, give us a shout and we can kind of submit your suggestion there. Or if anybody wants to, if anybody wants to be involved as a trainer, equally we provide guidance to build a pool of trainers who again can kind of come and support delivery of the programme. And I've seen a couple of names in the attendees list from prior participants. So yeah, nice to see anyone. And again, if any of you want to pop a note in the chat about your involvement with ALP, then obviously feel free. I think the other two things that I will draw attention to on here before I hand over to Owen are the data masterclass for senior leaders and ALP for leaders. So, you know, we can have the most skilled data and analytics professionals in the whole world, but if the leaders and decision makers aren't aware of where that data's come from, some of the data limitations, you know, issues like bias and lack of transparency in presentation of information, then you know that information isn't going to be used appropriately to direct a service in the future. So we've got a couple of learning opportunities that we've piloted, and we're currently further developing with a view to run a kind of pilot version 2 next year. Those are both kind of 3 module sessions, if you like. We've got 2 different versions of a very similar course. One of them is self-paced study online. The other is kind of taught sessions. And again, different people have different preferences for kind of self-directed versus taught sessions. So I don't have a date to be able to let you know when those might become available again. But again, on the pilot of ALP for leaders, we did have some colleagues join us from local authorities who again fed back that they were quite sort of positive experiences. And again, we're in the midst of a kind of 3-month follow-up with selected participants who all have kind of confirmed that, you know, not only has it increased their confidence in understanding the process of acquiring, collecting, transforming and analysing data, but it's also improved their ability to formulate a question more effectively when working with data teams. So those have both been really really interesting pilot schemes to run. And then the other point to flag is that all of these learning programmes are very resource intensive to deliver and time consuming to deliver, and we've got reams and reams of resources that we want to make available as widely as possible. So we're working to develop those into an online resource that can be accessed again, obviously across health and social care. We've got a pilot module at the moment in a virtual learning environment in Learning at Wales, which I think is an NWSSP hosted platform, but it uses Moodle, so you know it's a kind of open source platform. And we're doing a kind of small assessment of that proof of concept before trying to build up additional content in that virtual learning environment to enable people to access some of these learning opportunities at a time and place that suits them. So lots of activity in the capability space, but all in support of enabling improved analytics so that when organisations are on board into national data resource products and services, they're super skilled and able to make the most really of those products and services, or any other kind of products and services that might be in place that are used for data storage and exchange. So I think that's it from me. Thank you very much for having me and for listening, and yeah, welcome any questions. But for now, I will hand over to Owen to pick up from there. Thank you.
Thanks, Lou. Really interesting, as always. I'll just share my slides. At least attempt to. Somebody can give me a thumbs up when they appear.
Yep, got that.
Excellent, thanks very much. So for those who don't know me, I'm Owen Davis. I'm the Data and Intelligence Manager here at Social Care Wales. Part of my job is to manage the strategic approach for social care data in Wales, which consists of many, many different things, one of which is the National Data Resource and managing social care's involvement in the National Data Resource. The three things we're going to go through today. So how does social care become a part of the National Data Resource? Louise has been very clear that the National Data Resource as her programme of work is about health and social care, and the background of the work starting in a Healthier Wales was about bringing together everyone's health and care data into a single place. So social care is an intrinsic part of the project. We're also going to look at what we've done so far. So we have been working with social care data and with colleagues in social care about figuring out what we do to get social care in a position so that it can join in with the National Data Resource and provide data to it, and the kind of next steps. So before we do that, a quick kind of look really at what social care in Wales looks like. So we differ from health structurally. Health is delivered under a single banner of the National Health Service. It's not a single organisation. It's about 70 different organisations that work together under the banner of the NHS. Social care is much, much more fragmented. So we know there are 22 local authorities. It's about a third of the work that's delivered. Most of the assessment case management stuff is delivered from local authorities, but then there's a huge number of providers and services that are provided by those providers across Wales. About 1,200, a little bit more than 1,200 individual providers, and they deliver about 1,800 services across Wales. And they're a mixture of commercial, not-for-profit and third sector organisations. We're also seeing an increasing number of micro-enterprises, so a few people come together to create a small little business of their own. As you can imagine, 1,200 different providers, or more than 1,200 different providers, the integration of those data into a single place is a kind of unique and kind of large-scale challenge. So if you look at some of those challenges, and the reason why we want to overcome those is that the National Data Resource becomes much more valuable as a tool if all of social care can join in. So if we've only got the local authorities, that would be great in and of itself, but we know that a lot of the power of the NDR and the portability of data that the NDR would provide will be much more beneficial if we can get all of those providers to be involved wherever we can as well. We do know about some of the problems that social care will face in joining the NDR. We'll talk about that a little bit shortly. And we know that there's a huge amount more work that we need to do to get social care, social care data into a position where it can be successfully put into the NDR itself. So what have we been doing already? There's a couple of pieces of work that you may have been involved in, you may be aware of, or you might just be hearing for the first time today. So most recently, we delivered in the last year, in fact, a data maturity exercise with local authority social services departments to look at their data maturity. So data maturity is essentially the ability of an organisation to use the data that it collects successfully. And this is one of the things that we did to be able to understand what we might need to do in order to get social care data into the NDR. We concentrated on local authorities first, because we knew that all local authority used electronic case management or electronic case record systems. And we also knew that there was a degree of data maturity already in local authorities, which might not be apparent universally in the independent social care sector. The second bit of work does involve that wider sector, and it's not just about data in this case. We've included digital as well. And part of the reason for that is that we're not entirely sure how digitally enabled a lot of the social care provision is. We'd expect larger organisations to be using digital systems to manage their work now, but there is still in Wales a huge number of small or very small organisations that might not be necessarily digitally enabled, and also the staff that work for the organisations. Most of these, most care workers, their work on a day-to-day basis is face-to-face direct work with people who require care and support, not sitting in front of a computer using a computer system. So their confidence in using such systems as well might also be limited. So here's some of the things that we picked up from the data maturity exercise that we did with local authorities. So we looked at the objectives in terms of sharing data. So all local authorities share data to comply with their statutory requirements. We'd expect that. And then there's kind of varying amounts about why they use or share data for other different purposes. We also see in terms of data sharing is the mechanisms which they use to share data at the moment are almost all manual processes that, data shared via email or letter to partner organisations. So some even using fax as well. The NHS has got a fascination with still using fax machines for certain things, which is interesting to say the very least. If you look at the people that local authorities are sharing with, Welsh Government, other local authorities and health service are the three biggest areas, although there's obviously a couple of local authorities who we don't share information with other local authorities either. If we look at the lowest on that list, employment and job placement agencies would be the lowest. But again, it looks good on the face of things. Local authorities are sharing information with other people. But then we start to look at the local authorities in terms of agreeing or disagreeing with the following statements. And some of the challenges in terms of being able to share data effectively. So the more blue you see on that list, the less they agree with that statement. So we know that from that, we can see that more than 50% of local authorities haven't got any standardized data formats or use any kind of interoperability framework. In order to share data successfully, these are the kinds of things that we're going to need to be able to overcome. They don't have any advanced technologies for data sharing, and they're also not actively seeking feedback to improve the quality of their shared data, partly because in a lot of cases that data might be shared as a printout or a PDF and not shared programmatically. So, you know, there isn't necessarily a need to be able to, other than data which is shared for statutory purposes, perpetually check data quality as well. If you look at some of the barriers, you know, the usual one comes up: insufficient resources. We know we don't get enough, particularly in social care, and particularly in relation to health, within when you look at social care resources around data and technology. We know the quality of some of the data that we've got isn't the best and could be better. And we know we don't have any standardized way currently of describing the data that we collect. There isn't a you know, a Welsh or a UK standard for defining social care data in the same way as health might have by using something like a clinical coding system, for example. So how do we overcome some of these challenges? So we've got a kind of hit list, a roadmap really of some of the things that we're going to need to do to enable social care data to get to a place where it's able to be used or ingested by NDR. We're working on the principle of NDR's two primary use cases. Louise has kind of mentioned those in passing by means of the products that support them. So the first is the use, you know, the sharing of data across system and across organizational boundaries. It's sometimes called federating data. That is going to be facilitated by the care data repository that Louise mentioned. This is all personally identifiable information that is all squished together in the CDR, and then rules applied which will determine, you know, who, when and where that data is shared with programmatically. And then the second part is the use of data in advanced analytics and research, and it'll be the NDAP and the secure data environments that enable kind of pipelines into other data environments that will allow that. So those are the two areas that we're going to focus on first with NDR, even though NDR in and of itself has got a number of other use cases that it, you know, will enable in relation to data. You know, thinking of things around machine learning, AI, and other kinds of stuff. And to do that, the very first thing that we need to do is to start to describe our data. Now, you'd have seen this acronym come up, FHIR, FHIR. It's Fast Healthcare Interoperability Resources. So this is the interoperability framework that's been chosen for the NDR. It's also the interoperability framework that's been chosen for health and social care data across all 4 nations of the UK. We're working together with the other 3 nations, so England, Scotland and Northern Ireland, to come up with a system of describing social care data that's compatible to ensure data portability, not just within Wales, but across the other UK nations as well. We know there will be some differences, but one of the benefits of FHIR and the new kind of way that data interoperability and data sharing is achieved isn't through getting people to work in exactly the same way. It's about using, having a degree of flexibility within the system to allow for local differences, to allow for systems differences, so that the information can then be translated into a single format and then shared across those systems boundaries. So it is a new way of sharing information, and a way that doesn't mean that everyone has to adopt exactly the same method of working. It also accounts for the fact that some things that you're going to need to share, in fact, quite a lot of the things that we're going to need to share, are essentially things which contain, hundreds of different data items. In this case, it will pack those data items up into a single shared resource that doesn't necessarily in each organization have to contain exactly the same data items, as long as there's general understanding of what a care and support plan or an assessment might be, for example, amongst all 22 local authorities. The objects or the data elements, the fields that lie within that that bundle can be different between different organisations. To do this, we're going to need to speak to people, and a lot of people. It's not an overnight job. It's probably going to take years to reach the end of describing social care data in its entirety, but we will slowly start to pick it off as we go. The other thing that FHIR allows you to do is just to define the data items that you're going to want to share initially. We don't have to do everything. And first and foremost, we're going to be developing something called a minimum operational data standard. One for adults has been developed in England as a proof of concept already. We're taking that and looking to see how compatible it is with Wales and what we would need to change. Again, it doesn't necessarily matter that we'd have differences. These are accounted for and accommodated within the FHIR framework because it knows that not everyone works in exactly the same way. So we will be contacting local authorities, social care providers, and some of the wider stakeholders to discuss data sharing requirements and priorities in the coming the remainder of this financial year and the next financial year. How do you do that? Well, mentioned investment again. We're going to need to spend a lot more money. We've put a bid in for funding from the NDR programme itself, and also to Welsh Government to help us to achieve some of the objectives that we've got. So those are going to be objectives around the standardisation approach. We're also going to work with the local authorities who are replacing the incumbent WCCS system with their new systems. Again, because of the adoption of FHIR standards on a UK basis, any UK provider of health and care systems will already know that FHIR has been chosen for as an interoperability standard, and we'll already know in many cases that compatibility with FHIR is a must for most electronic case management systems. And we need, as I mentioned earlier, we need to make sure that we understand the capabilities of all of social care. There's a bit on the bottom there. They did this work in England a couple of years ago. What they realised there was about 52%, I think, of social care providers in England didn't use any digital systems to manage their work other than, office products like Word, Outlook, and Excel. So if we want to get those people using the NDR, we're going to need to be able to need to encourage them to adopt digital ways of working. In England, they needed to set up a gigantic fund to allow those providers to digitize their work. We don't think we're going to be any different in Wales. In fact, we've got potential to be worse, but the results of that digital and data maturity across all of social care provision will hopefully be released by the end of this financial year, and we'll have a better understanding of what we'll need to do in that respect as well. Louise mentioned advanced analytics work. We know that there's a shift that we need to make from data analysis and the concentration of that we currently have on some of the statutory data requirements and data reporting and getting better with our data skills. So that includes having more data engineers, data managers, data scientists, more people with advanced analytical skills, to be able to use the tools that are available to us in NDR and to be able to, truly exploit the data that we've got. That means that we are going to need to start employing more of these people, but also we need to start developing the individuals that we already have within organizations to get better with data. And that includes, the availability of the learning opportunities that are part of the NDR program. And also elsewhere. So we also know that, there are apprenticeship schemes available, and there's a whole host of other training opportunities that are available outside, both paid and free to use. Part of our understanding is about the professionalization of data as a proper professional career, and giving staff the space that they need to be able to develop their skills if those opportunities become available. We also know that we don't want to be tied into any specific environments if we don't have to. So fire is completely non-proprietary, open source. There's no cost to it, so we don't have to pay people to be part of that interoperability framework. And it's controlled by the people who develop it as a platform. There is a number of repositories you can already go and have a look at that have got fire standards in there. It uses, most people use there's an XML version, but most people use the JSON, JavaScript object notation version of fire. JSON is meant to be both human and machine readable. So even if you don't have specifics, a specific understanding of how JavaScript works in relation to data, you'd still be able to understand what that data object is referring to, or data element is referring to. We're also looking to provide people with fire training as well, so that they're able to both understand, exploit, and potentially write fire standards for social care data in Wales too. Where I mentioned this already, but the engagement with people is critical. There are, tens of thousands, nearly 100,000, in fact, people working in social care in Wales. We can't speak to all people, obviously, but we do need to speak to a representative bunch of individuals in order to truly understand the data sharing needs, the barriers that prevent this from happening, and the things that we need to do in order to make data sharing, much better, and the NDR functional for social care in Wales. And that's then goes on to the last one about in order to make NDR work, it's got to be built collaboratively. This isn't a Social Care Wales programme, and it's not even a DHCW programme. This is a programme for all of health and social care in Wales. It involves local authorities, providers, health boards, GP surgeries, hospitals. The list goes on and on and on and on. Essentially, it's a giant piece of work, but we have to build it together. And there has to be that kind of collective desire in order to make us get to a position where, the NDR is a thing that we can use. There's a couple of things which we haven't mentioned, I don't think. One of which is an NDR in and of itself isn't a system. It doesn't replace your electronic case management systems. In social care, for example, they still exist. What it allows is the data from your system that needs to be shared with somebody else to be pushed into the NDR so that it can be shared with somebody else, or something else. In fact, if it's a computer we're talking about. So it doesn't replace your systems. It's just a piece of kind of middleware that contains all of the data that it needs to share across Wales. And I think I'll probably stop there. And open the floor up to any questions.
Oh, thank you, Owen, and thank you to Louise as well. There's a lot of information, but a lot of really, really important information there, and hopefully all of you have now got a good understanding of not just what the NDR is, but what it actually means for you. There is one question in the chat. So I was going to ask about the position on investing in local data skills to allow us local authorities to enable the data preparation, data management, and the future data feeds. Does this mean that there is recognition from the NDR programme that funding will need to be made available to the LAs to enable this? Don't know which one of you wants to answer that one.
Well, I can start. So the training provision that has been provided and which will continue to be provided is funded by the NDR. So the analytics learning programme, things like access to Google Skills Boost, the analytics learning for leaders, and the continued expansion of that learning provision and expanding access via a VLE. All of that is kind of covered by the NDR and the resource to deliver on that. The resource to deliver on some of the other aspects around standards development and the capabilities that will be needed around that, we're just starting to explore in this next phase. So everything within the NDR to date has been around evaluation, assessment, understanding from a local authority's point of view anyway, and we're now moving more into the doing something about it space. So the funding side of it is growing in terms of the amount that the NDR is requesting from Welsh Government to cover that aspect. But it is understood that with 22 local authorities and numerous other providers to address, that is likely to need to continue to grow in future phases. So we're heading into phase 4 of the programme now. So what's that, year 6 of the 10-year programme, and what that looks like now for the remainder of the programme. It's a 2-year cycle in terms of funding request and approvals. So it would be in a future phase that, you know, we'd seek to request additional funding to look at implementation as well.
I just add to Louise that the next iteration of our health and care workforce development plan also recognises that there are roles which are, you know, non-clinical, social work practice roles, which also need to exist within a healthy social care workforce, and those include roles around data and digital, and the fact that, you know, if we don't have enough of those roles and they're difficult for us to recruit, then we should be growing our own in the same way that we do with our social care professionals, particularly from my perspective, you know, social workers and care workers. And for those roles, there is help for individuals to pursue learning opportunities or qualifications in that space. And again, you know, we're looking at how we might be able to do that more effectively as well. So again, you know, Christopher's early days in that respect, but it is something that it's definitely a work stream that we both have, you know, both from a health and care perspective, and we're looking at all opportunities that we've got to be able to provide some of those opportunities for people to invest in those local data skills, as you said. The other one is about connecting care and DHCW. They are connected. I meet regularly with the connecting care team in DHCW, so Damien and Lee. Damien's also a part of the 4 Nations group that is exploring fire, and as part of the bid that we've put in for NDR next year, we've got a role which is specifically tied to connecting care and how we connect those 2 programs up. They're different because NDR, as I mentioned, isn't a case management system. It's just a repository of data that allows sharing. But they are inherently connected in that we would want our electronic case management systems to be fire capable and have this thing called a fire facade, which is the thing that does all of the WYSI translation and everything overlaid onto it. And we also want everyone involved in the Connecting Care projects, and all of the local authorities and everyone else uses the system, Connecting Care or not, to be involved in the conversation about data standards. So data standards are not necessarily tied to a system. They should, in fact, be system agnostic, but they do have an impact on systems. So, if we expect everyone to have a minimum data set that all systems need to adopt, then obviously that's going to have a bearing on those systems. The positive in that sense is that the vast majority of systems players in the UK are already going to have customers in England or Scotland or Northern Ireland, and will already know that it's the fire has been is the chosen standard there, and will already be beavering away in the background to make their systems fire compliant anyway. So they are separate programs, but definitely connections exist between the two. Hope that helps.
Very helpful indeed, and that brings us to 1 o'clock exactly, so perfect timing. What I will say is, if you have got any other questions for either Louise or Owen, you can either add into this chat, which should stay open and we can keep an eye on that, or else they've already shared their contact details anyway. So all that it remains for me to say is thank you again very much to Louise and Owen for today. I hope that you as attendees have enjoyed it and have gotten out of it what you wanted to, and we will be in touch very shortly with the slides and the feedback form and a copy of the video that you can share on to those who are unable to attend today. So thank you very much everyone, and goodbye.